This Week in Virology, the podcast about viruses, the kind that make you sick. From Microbe TV, this is TWIV, This Week in Virology. I'm Vincent Racaniello, and you're listening to the podcast all about viruses. We're back at the Nipah Virus International Conference in Singapore, recognizing discovery of this virus 20 years ago, and my guest is President of EcoHealth Alliance Peter Daszak. Welcome to TWIV.
Pleasure to be here.
Daszak, is that good?
That's great, perfect.
Where are you from?
I'm from the UK, but the name's Ukrainian.
Really?
Yeah.
So at some point your family moved from...
My dad was Ukrainian.
Ukraine. I want our listeners, and we have many, between 10 and 20,000, science aficionados, including scientists. I want to learn about the EcoHealth Alliance. What is it?
Well, we're a non-profit, a typical charity.
501c3,
yeah,
right?
501c3 in the US. But we're very focused on research. So what we're trying to do, really, I guess the difference that we're trying to do is do the science and publish in the best journals you can go for. Mm-hmm. A typical academic strategy, funded by federal government and other sources, but then try and take the science and do something with it on the ground. So that's the charity side. That's the 501c3 side of it.
Got it.
So I like to try and mix that together.
I don't do that. I don't go on the ground. I stay in the lab.
I'm from basic science originally, but I've always had an applied bent, and I just think it's good to actually see some results on the ground. It's very hard to do, of course.
Yeah. But I think, as this meeting shows, it is increasingly important that you apply, because in the end, human health is the important factor, right?
We're in an applied field, so it's great to be able to see that difference. Yeah.
When was it founded, the Alliance?
Well, we've been around for a long time, over 45 years. It was originally set up as a conservation group, Wildlife Trust.
I see.
And it was linked to a British organisation. No link to me. It was just that's how it started, and I eventually took over. Yeah.
Oh, so it started long before you joined.
So long before I joined, and it was purely conservation, and health programs started to come into it. One of the reasons was a lot of the field workers were getting sick with pretty unusual diseases. So there was a bit of an interest in this, and the health programs proved kind of so interesting and well funded and well supported and well liked on the ground that they took over.
I think you're headquartered in New York, right? It's funny that here we are in Singapore. We're talking. We never got together in New York.
That's pretty ridiculous. In fact, I'm an adjunct at Columbia, so I don't know why we've never. But there you go.
So here we are. I'd like to know a little bit about your history before going to the Alliance. You're from the UK, you said.
From the UK, and I sort of went through. I was always interested in nature as a kid, so I wanted to do zoology. Ever since I was 8 years old, I wanted to be a zoologist. And I was on that track. I did a zoology degree. I was going to work on, I'm a reptile fan. I wanted to work on reptiles. And then in England, in your third year, you have to pick a research project. And I was late to the table. And the only one left on reptiles was, there was no good behavior stuff. You couldn't go to the jungle and watch them. It was ultrastructure of a parasite in a lizard's gallbladder. Okay, well, I'll do it anyway. But it was so fascinating. I just got hooked on research. I got hooked on seeing something for the first time and getting a result that tells you something that no one else has seen. I found that fascinating.
So you decided to get a PhD?
Yeah, I got a PhD in a similar field. I got a PhD in coccidiosis. Okay. That was the parasite.
Where did you do that?
In England, in London. Yeah, University of East London.
Okay. And did you do a postdoc after that?
Yeah, I did a couple of postdocs. It was in a pretty bad time in England. There were 1 year postdocs. Kept getting refunded, but it's not a great, great support.
What areas were they in?
Similar stuff, parasitology. But I was a sort of general, because I could do electron microscopy.
Okay.
I would work on a bunch of different projects.
I guess you know my colleague Dixon Despommier, right?
Oh yeah.
Because he's always mentioned you.
Yeah, he's great.
He always says we have to get Peter on the show, and I don't know why it's so hard being in New York City. And then after these postdocs, did you join the Alliance?
It's no, really. What happened was my wife got a job. She's from the UK as well. She got offered this job in the US, and we sort of thought about it for a year or so, and eventually. It was a great job for a biotech company in Atlanta, and I gave up my job and came over as her tag-along on a visa. And you have to wait a while before you get your work permit. So she said, you should go and volunteer. And I thought, well, am I going to do that? So I volunteered at CDC. And it was during the Nipah virus outbreak. And I was in the lab doing electron microscopy on the first samples that came over. So that Nipah connection went right back to then. I was just volunteering. It was cool.
Wow, that's amazing, especially since we've heard that at this meeting, right?
Yeah, and I saw some of the pictures that I worked on.
Yeah, and that's when it was clear it was not Japanese encephalitis virus, right?
Yeah. Well, by then they knew that it was something unusual, Hendra-like.
And at that point they said, let's work on it more carefully than we've been so far, right? BSL-4.
Oh, for sure. Yeah. And up until then it was a JE suspect. So it was in BSL-2 plus situation.
Right. Yeah.
Pretty risky.
Well, I heard that for years they used to work on Marburg in Germany in just glove boxes before they realized and before BSL-4 and was okay. Nobody got sick. Not a good thing. When did you join the Alliance?
Well, so I worked, I went over to University of Georgia for a while, did some research on amphibian disease. I was still doing the wildlife stuff. And then I just applied for a job up there in 2000, 2001, something like that.
And you worked your way up?
I got a job as coordinating a project between 5 universities and what was then called the Wildlife Trust. And then it just got so well funded that the health programs were so well supported that they kind of took over. And then the president left, and I got offered the job. So about 10 years ago.
So if I came to your offices, where are they located?
Midtown, 34th and 10th.
If I came, would I see offices or labs or both?
You'll see offices, and you'll see folks doing, economic modeling, analytics, sequence crunching.
Right.
The labs are all around the world, including we work a lot with Ian Lipkin up at Columbia.
Right.
But every country we work in, we have a lab partner that's a good lab. And if there isn't a lab there, we build one, or we get funding to kit it out. That's the strategy.
And so you have employees, obviously, right? How do you decide what you need? You don't hire lab people, I guess. You hire computer people.
Well, we hire lab people too. What we do is I guess my strategy is to limit the bureaucracy. This is really one of the key benefits about being outside of the academic system. You do miss a lot from universities. You're out on your own. There's no support. But one of the great things is you're free to quickly change. So you can hire people quickly and out of the box or from different disciplines. And what I like to do is mix up a lot of different disciplines together in a room. So when you're brainstorming what you're going to do about an issue, you've got an economist, a mathematician, a veterinary, a microbiologist, and they're all in the same room thinking about this one issue. And that's really what I think is successful and gets me excited about it.
So you have a lot of meetings with not just people in New York, but in all your remote sites as well. We
were early adopters of video conferencing.
Right.
And in fact, it's great. During the recession, we got, you remember the American Restoration Recovery Act?
Yes, I do.
So we got ARA funding for a video conference facility because it reduced our federal, demand on federal money, so we could have these meetings and stuff.
Without traveling. Yeah.
So we're always on conference calls, twice a week, late night conference calls to Asia, Africa, and Latin America. So,
right. Yeah. So how do you pay for all this? You have people give money, right?
Raise money, yeah. And another advantage of being a 501c3 is we have this history of being a charitable sort of conservation, saving wildlife organization. So we've got all the major donors that support that. We've got the public that donate. We have a charity gala in New York every year. So we have all these sort of non-profit things we do. But over 80% of our funds comes from federal support. So we, like a university department, we're going after federal money all the time. Yeah.
Okay. Is it difficult to raise enough money for your needs?
Well, it's great when you get it. I don't know what. It's not easy, is it? It's pretty brutal, isn't it? If you look at your success rate on federal grants, I guess the average is 10% or something. So we're probably hitting above average, but it's just hard to spend so much time on a grant and then it gets rejected. It's upsetting.
I'm very aware of that because that's how we support our lab. It's getting harder because more and more people are coming in the field, which is good, but it's very competitive. And the money has not gone up sufficiently. The problem is when the money does go up, it doesn't matter because the universities grab it for making buildings.
We have an overhead, but of course, that's the other thing. You're a small organisation. Everyone knows where the overhead's going. There's no... You see the benefits of that because it goes right back to you. So that's another slight advantage.
Do you have support from, say, Gates Foundation?
No, we don't. We never got Gates money. And I think that Gates had a strategy of specifically targeting things that they considered neglected, diseases that were neglected. We're working on what they consider not neglected diseases. Even Nipah, which isn't a big pandemic issue every year, to Gates it's considered neglected, not neglected. But they're kind of moving into this space a little bit more, but we've never got funds from Gates.
It's interesting. Yeah. I mean, I guess judging from this meeting, Nipah is not neglected. Right?
No, not right now. No,
there are a lot of people, which is good. But on the other hand, he can decide where to put his money. But there are other charities also. But
yeah. I mean, we get money from foundations. We get money from private sector. So one of the things we've been trying to do is we work a lot on the underlying causes of pandemics: deforestation, climate change, wildlife hunting. That's our conservation side as well. So we go to foundations and say, look, you've been trying to stop the wildlife trade in China for 20 years. You've put all this money into it. If you have a health angle to that, it really does work. Yeah. The markets, the wildlife markets in China were never closed down because of, ethical concerns or conservation. But the minute SARS emerged, they closed them down.
Right.
So that's the argument we use, and we're trying to put the health in conservation.
I see. So give me an overview. You said you have labs throughout the world that you work with. They're not employees of yours, though? You contract them, or some of them are?
Usually we subcontract to labs, but we usually try and have, in every country, a country program officer who manages the work we do in a country, sometimes regional. And we often hire technicians in labs or PhD students, to have a presence in the lab. There's more of a buy-in when you've got a person there.
Okay. And in these remote locations, like John Epstein, for example, is at this meeting and is involved in surveillance. He's mostly in New York, but he'll go to field sites periodically and do work as well. Do you do that? Do you go out in the field?
Yeah, I still do. I have two countries that I still kind of am in charge of in the organisation: China and Malaysia.
Okay.
I've got a long-term history of working in Malaysia. So does John. So I go out there a heck of a lot.
Right. Okay. Yeah. So the point is to establish capabilities in other countries, not just take specimens from them and bring them home, right?
That's right. That's the strategy. And, it's the old adage that if you teach people how to do it and give them the capacity and the tools, then you've really made a difference. And the money always dries up. And this is something we've seen in the non-profit world. You get great funding for 5 years from a foundation. They always shift priorities because that's what they've got to do. They've got to keep it fresh.
Sure.
So if you've built a structure and trained people, they're in their own country raising money locally. You've left it. That's the alliance part of what we call,
How many countries would you say you're in?
Right now, it's probably about 30 countries. Yeah.
Okay. So let's talk about some of the programs. I was perusing EcoHealthAlliance.org. You probably, when it started, there were no websites, but now everyone can see it.
That's right.
So let's talk about a few of these. They're really interesting. And then not all of them have to do with viruses, right?
Yeah, that's right.
Some of them do. Some of them have to do with other things. So there's one about establishing biosurveillance networks in Western Asia.
Oh, WabiNet.
And you have nice acronyms for all of these.
Everything's got an acronym.
WabiNet. Why Western Asia? Which is about where we are, right?
No, Western Asia is very specifically sort of the stands, Pakistan, Kyrgyzstan, all these places. They're the countries that need support, so they get a lot of US development money.
Got it.
They're countries that are security risks, so there's interest from DoD. And I think the funding for that comes from DITRA, Defense Threat Reduction Agency.
Right.
And the idea is you're training scientists to do good work and learn how to live and function within the modern science community.
Are there any particular threats that you're interested in that region?
Oh, there's a lot of pretty unpleasant pathogens out there. Plague is still out there. No one's really done deep surveys of bats out there and the viruses they carry. We expect they're going to carry similar viruses to Hendra, Nipah, SARS and others. So that's what we're looking at in that.
So that's something you'd want to do, survey bats? Yeah. Okay. And then there's the Western Asia Bat Research Network.
Okay.
That's that one, right?
Yeah.
That's got an acronym too. WABAR, I think. And so it's also Western Asia looking for viruses in bats. And then there's another program for Rift Valley fever. So let's talk a little bit about that.
Yeah. Well, Rift is, I think people talk a lot about One Health. Rift is a classic One Health disease. It's a human, wildlife, and livestock disease. And, we think we know a lot about these things. I mean, I'm always fascinated. You talk about, should we do some work on Rift a few years ago? Well, no, everything's known. People know what's going on. There's predictive models that show when you should move the vaccine supply to prevent outbreaks. So as good as it gets, there's a vaccine. But it turns out there are huge gaps. For instance, there are these very long gaps between outbreaks, sometimes 10 years, more than 10 years. The virus is out there, and the mantra is that it's in mosquito eggs and dried out dambos. And then when it floods, they pop up, and out comes the virus. It turns out there's actually some evidence of cycling in wildlife, wild antelopes and others. So we're looking at that and trying to say whole systems approach, a real One Health approach. What's going on in wildlife, and does that allow the virus to cause risks to farmers, even outside of those outbreaks?
Right. So you're sampling wildlife and looking for the virus.
Yeah, sampling wildlife, sheep, people, mosquitoes, soil, the whole gamut.
So currently they vaccinate cows, right? Cattle.
Yeah, and sheep,
And sheep, but that doesn't prevent the virus from circulating in wildlife.
That's right. It's in ungulates, and they're out there in the wild.
So if you find virus out there, what do you do about that? You can immunize the cattle, but what about people?
What we're doing is we're working with farmers, and the target audience, and it's in South Africa, so the target audience is sheep farmers who care about losing sheep. The ultimate bigger picture is pandemic risk and movement of the virus into, bigger areas. So we're working with farmers to say, can we predict better when to vaccinate? Is it, it's not always just once every few years. It might be once a herd immunity drops below a certain threshold, virus is going to come from the wild ungulates into the flock. So that's the target.
So currently this is an African disease. Yeah. And I think you mentioned on your website, people worry about it spreading elsewhere, right? Is that realistic?
Oh, because one of the things about Rift is it once it gets into livestock, it can then be transmitted directly from blood and meat into people. So it becomes a huge risk for people butchering animals. And that the big event is the Hajj, where everybody has to butcher and eat a sheep, lamb, whatever. Right. So there's this high risk around the Hajj. CDC's aware of it, WHO's aware of it, and they monitor. And Saudi Arabia does a great job monitoring the Hajj. But what about these other areas, these other regions, and these other risks? Okay. It's definitely a pandemic risk for sure.
Could it get into the U.S. even?
Yeah, through meat or
meat
through
coming in. Yeah. Now it's mosquito transmitted, you said.
Yeah.
What kind of mosquitoes?
Okay.
Or do we have them here in the U.S.?
We have some here in the U.S., so there's a possibility of that too. Yeah, but I'm not a mosquito expert.
You worry about African swine fever?
Yeah, well, we've been working in China for many years, and China's took a huge hit from African swine fever right now. And the price of pork's gone up. That's a big issue. They're the biggest consumer of pork on the planet, biggest producer.
Right.
They're importing US pork, so that's good for US producers, but it's just not good for the planet. And you think about other countries in the region that are less biosecure than China. It's a threat to everywhere.
Do you have people in China working on this?
We've been working in China for years, but not on African swine fever. We actually discovered another disease in pigs, swine acute diarrheal syndrome, that that emerged, SADS, yeah, good acronym, that emerged out of bats, and just, the capacity for these viruses to pop up seemingly out of nowhere and cause 25,000 pig deaths, and for that to go unnoticed for a long time is incredible. And when you think about the huge production of pork in China, diseases that look like another disease, it's a diarrheal disease, looks like a PDV, can just get missed, and that's the worrying part.
Right. Now, in all these places we're talking about, you have people who are supported by you. They're paid by you, and they're working locally, and you periodically interact with them and see and provide advice. And do they
periodically is every day?
Every day.
Yeah.
So they don't mind that. They appreciate that.
Yeah, of course. I mean, so it's like, it depends who they are. I mean, look, we have our staff in countries funded directly. We have subcontracts through local universities or agencies in country, and then we have contracts to do work. And we it's all collaborative science. So people love to interact on collaborative science. What I've found, especially in places like China, where increasingly there's a paranoia around collaboration. Science collaboration is open and transparent because of the nature of what you're trying to do. You're trying to discover stuff quickly, understand what it means, publish it in a high-impact journal, and that drives openness and transparency. And that's been great for us around the world. It's also great for the US, and we really need to push that agenda, I think.
Yeah, publishing is a very interesting mechanism. You have to publish, and by then, when you publish, everyone has it. To use.
It's kind of unusual,
It's called, I spoke to an economist recently, she said it's making a public good out of science, because if you don't publish it, you're not recognized.
And also the business model of science is weird as well, because I'll never forget, the first time I published a paper, my brother, he's an opera singer, came to visit me and he said, "Wow, look at this, your name's on a paper. Cool, how much did they pay you for this?" I said, "Well, nothing."
Right.
In fact, we had to pay the page fees.
So here's a couple of others I noticed. PREDICT.
Yeah.
That's an acronym. What does that do?
It's not an acronym. It's a capitalized non-acronym.
Oh, I see. But it tells you what you're doing.
That wasn't our name. That was USAID that came up. They came up with a whole gamut of programs in their emerging pandemic threats program. Predict, respond, prepare, prevent. There was also a little bit pretentious. But Predict, it's a great project. It's just finished, sadly. But 10 years of surveillance in wildlife, viral discovery, finding new pathogens, surveillance in people, trying to find evidence of those new pathogens spilling over, trying to identify where the high-risk human, wildlife, livestock interfaces are on the planet, and really, ultimately, get better at predicting where the next pandemic is going to come from.
Another one is emerging infectious disease research. You say you're training scientists in other countries to work on that.
Yeah.
Right?
Yeah.
And you give them lab capabilities.
Well, we try and I guess we train them in One Health approach.
Why don't you explain One Health? You've mentioned that before.
Yeah. I mean, so this is really pretty simple. I mean, a lot of health issues, a lot of disease issues have an environmental connection, a human connection, and an animal connection. We really work a lot on zoonoses now, so they're all One Health issues. But what we do a lot of is to look at the environmental side of that, what's driving that disease to spread or spill over into people. So, trying to understand patterns of ecology, patterns of environmental change, sometimes really long-term patterns, to get a better handle on what's going on the planet.
We heard a lot about that with respect to Nipah and being shed from bats, right? Yeah. We don't really know what drives peaks of shedding,
right? As
far as I could tell.
Yeah.
But there are limitations that you have to do serology most of the time.
Yeah,
right?
yeah.
It's hard because you may be missing the actual infection, right?
I mean, what we've done with Nipah, and John Epstein's got a paper in review right now that's pretty cool, I think. By doing a long-term longitudinal study over multi-years, you get around the seasonal issues, you get to see that. You don't get enough N with PCR. You get a few hits because these are rare viruses, even in the reservoir.
Yeah, yeah.
To find that 1 week infection in a bat, you've got to sample thousands. So we did. What we found is good serology. And if you've got a modeler that understands And you've got data on when animals become seropositive, how quickly immunity wanes, what the age structure of that is. You can actually look at those populations and begin to predict viral shedding peaks from serology. So that's what we've done. And we've shown that it's not annual, it's more likely biennial. And it's not a seasonal issue. It's not related to birthing pulses. These bats give birth synchronously.
Right.
So, yeah, it's still a mystery what drives that, but we'll get there.
I heard at this meeting that there are bats in other countries harboring Henipa-like viruses, like South Africa.
Yeah.
Do you have a presence there at all?
Yeah, we do, through Vanda,
who she talked
here.
about it. Yeah,
we're collaborating with them.
Fascinating. All right, so another area is deforestation. Explain why that's a driver of emerging infections.
Well, when we changed our name from Wildlife Trust to EcoHealth Alliance to focus more on the health side. We thought that was our unique non-profit approach. But we wanted to maintain the conservation angle to this. So we picked two big issues. One is deforestation. And the reason is it drives emergence. In our global analysis of emerging infectious diseases, land use change is a globally significant predictor of a pandemic risk, I guess you could say. You cut down the forest, you build a road into a patch of forest, people go in, they hunt wildlife, you get a new pathogen.
Right.
So what we're trying to do is a really simple strategy. If governments are chopping down forests, why are they doing it? They're doing it for economic growth.
Right.
Right. So what's the value of that? So you look at ecosystem services, you look at the value of the crops they produce, but then there's this other thing that's never been done, which is you get a new disease that emerges, can have incredible impact economically, like SARS, $10 to $50 billion of impact. In Malaysia, zoonotic malaria tracks really closely with land use change. So we went to Malaysia, we calculated the cost of every case of malaria. We put that into the equation for ecosystem services and show that palm oil production specifically loses profit because you're paying for malaria. You cut the forest down, you pay for malaria cases and control for another 100 years.
Sure.
So there's a loss that's unaccounted for. And we're trying to show the government, this is costing you money, so don't be so gung-ho about chopping all your forests down.
Yeah, that's the same idea you said earlier. You close the meat markets, giving them economic, health-based reasons, right? Another one is global wildlife trade.
Yeah.
What are you doing there?
Well, we're trying to look at patterns of wildlife trade that include a risk of new diseases emerging. So we're doing a couple of things, really. So one is around SARS. We focused on SARS coronavirus emerged from a wildlife market and was the first pandemic of this century. So it's a big event. So we started to trace back from the wildlife market which species carried the virus that came into those markets. We found that it was bats, not civets was the original idea.
Right.
So then we started looking, where did they come from? And we went out to southern China and did surveillance of bats across southern China. And we've now found, after 6 or 7 years of doing this, over 100 new SARS-related coronaviruses, very close to SARS. Some of them get into human cells in the lab. Some of them can cause SARS disease in humanized mouse models and are treatable with therapeutic monoclonals, and you can't vaccinate against them with the vaccine. So these are a clear and present danger.
Yeah.
We've even found people with antibodies in Yunnan to SARS-related coronaviruses. So there's human exposure.
Right.
We're now doing surveillance. We're just beginning another 5 years of work to look at cohorts in southern China to say, well, how frequent does this spillover happen, and is it associated with disease? Because I expect, just like Nipah in Bangladesh, there are dozens and dozens of small spillovers going on the planet any one time, which we just never see.
Sure. Yeah, they never amplify. There are a few cases, and they're just absorbed in the illness, the overall illness of the population, right?
Now, you could say, so who cares? And that's one argument. But our strategy is any one of those could become pandemic. There's a lot of stochasticity in what happens then.
Yeah.
So if we look at all of them, understand patterns, try and reduce the number of spillover events, we've got,
But if you're saying these are diverse coronaviruses, and you can't vaccinate against them. There are no antivirals. What do we do?
Well, so I think that coronaviruses are pretty good. I mean, you're a virologist, you know all this stuff, but you can manipulate them in the lab pretty easily. It's just spike protein drives a lot of what happens with the coronavirus, zoonotic risk. So you can get the sequence, you can build the protein, and we work with Ralph Barrick at UNC to do this. Insert it into a backbone of another virus, and do some work in the lab. So you can get more predictive when you find a sequence. You've got this diversity. Now, the logical progression for vaccines is if you're going to develop a vaccine for SARS, people are going to use pandemic SARS as
sure.
But let's try and insert some of these other related and get a better vaccine.
And I guess also knowledge of what's there. If you see something emerging, it give it a head start on making a vaccine or a therapeutic.
That's true, and better knowledge of where they are as well, so that you can put your money into these clinics that matter. And that's one of the big things that we've been trying to push. There's a lot of the word predict, or the word anticipating, forecasting pandemics. It doesn't mean you can stop them. That's the problem. So what we're trying to do is say, on a global scale, if we can show where they're most likely to come from, the species they're most likely to originate in, the people most likely to get affected, a global actor like WHO or a national government can better allocate resources to the highest risk. It's pretty simple.
So you're doing a lot of activities. Those are just a few of all the ones you can find. How do you know if you're getting results? I know you publish things, right?
Yeah.
Are there any other metrics you use?
Yeah, well, you're very good at asking the right questions there, because we're doing our strategic plan right now, and our board has said to us, you need to monitor and evaluate better. And it's true. It's notoriously hard to monitor conservation success. And I think this is a similar problem. You've got near-term indicators, like number of people you've trained in villages. We designed these books called Living Safer with Bats, Living Safer with Wildlife, translate them into 20-odd different languages. And we educate folks in villages on these high-risk interfaces how to avoid spillover, basically. So near-term indicator, how many people have you taught in community outreach? But the real indicators are, have you prevented infections? Or have you had a policy change in a government that reduces risk? And we've done that. I mean, it takes a few years, but we have. We got the amphibian disease chytridiomycosis listed as a notifiable disease with OIE. We've got, the Sabah government is blocking building into some road building into some of these forests based on the health side. So there is success, but it takes a long time.
So you talked about these books, Living
Safely with Bats.
Can people get those somewhere?
I think you get them on our website. Yeah,
okay.
Sure. Download
Take a look.
Whatever language you.
All right. This is one last question, which has to do with Linfa Wang.
Oh yeah.
Do bats have more viruses than other animals?
Very good question, sir. I've got to say, with Linfa, I stand corrected on this. I don't know. I think last time I met you, we were debating that publicly. Every speech we give at a conference, I would say, put my hand up, Linfa, you've still not shown that bats have more viruses than any other group. Now, he never showed it. It was us that showed it. I challenged him, and Kevin Oliver, who works for us, spent 8 years on a project trying to look at patterns of spillover from ICTV data, super complicated, huge amount of work, and correcting for the biases in the literature. And Linfa was right, and we were sorely gutted. Okay. But
he said that at ASV this summer. He said
he's right.
He was right, but I just wanted to check it with you.
No, he was correct. I was wrong.
Okay. Are you having fun, by the way?
I love it. Yeah, I love this work. It's I guess you go back to your childhood dreams of being a zoologist in the Amazon. I'm not a zoologist in the Amazon, but I think that once you get hooked on research and finding new things out, there's something that plays to a fundamental need to discover in the human psyche, and it's great every day. And even when it's wrong, even when you find out that your analysis shows it's not a big deal after all. It's still.
I love it. I think what you're doing is fabulous.
Thanks, I appreciate that.
And keep it up.
Cheers.
So that is Twiv from NEPA conference in Singapore. You can find TWIV on any podcast player. Microbe.tv/TWIV is our website. If you have questions about anything you hear, TWIV at microbe.tv. And if you like what we do, consider supporting us financially. You can go to microbe.tv/contribute to make a contribution. My guest on this special episode, EcoHealth Alliance President Peter Daszak. Where can listeners go if they want to help you?
Go to ecohealthalliance.org.
Great. Thank you so much for talking.
My pleasure.
To me.
Great chatting to you.
I'm Vincent Racaniello. You can find me at virology.ws. I want to thank ASV and ASM for their support of TWIV. Thanks to Linfa Wang for bringing me to Singapore. You've been listening to This Week in Virology. Thanks for joining us. We'll be back next week. Another TWIV is viral.